quickly became apparent to me that patient-public community engagement was absolutely key if we're going to address issues related to equity, issues related to disparities in health, and also in building healthy and productive communities.
Particularly in research, there's often a gap between what a researcher or a clinician would deem as valuable and what a patient thinks is valuable in either the questions we're asking or in their own clinical care. Ensuring that patient engagement happens early on helps us define questions that are valuable both to patients and researchers.
Well, I think that the research, especially in the healthcare system, patient voice should be heard and should be engaged in the research. This is something that I think it should be come as a priority. The patient should be identify their questions. They should have a right to know what the research is going on. And they should have a right to understand the methodology as well as the data interpretations.
Patient and public engagement is really critical to clinical trials, I think, because without knowing, without engaging the patients or without engaging the public, when you're coming up with appropriate outcomes or research questions and things like that, you might have a research question that you think is perfect and a solution for a problem that you think will work, and if you don't engage the people who are living, say, a particular condition, you might try and even spend lots of money on developing a solution that won't work in a real world sense because you haven't, you've tested it in a laboratory or you've tested it in a very controlled trial, and when you try to translate that to real life, it doesn't work. And so that's where talking to patients or the public can help you avoid those situations.
I think patient-public engagement is important because as patients, we have a different perspective. I believe that different cultures, immigrants, and people with lived experience, we can bring a different perspective to this solution and be able to work with researchers to kind of collaborate and provide our input on how living with certain chronic conditions kind of impact our day-to-day lives and be able to incorporate that in our daily routine. And by working with researchers, they can kind of understand and be able to come up with solutions that we can incorporate in our daily lives without impacting our routine, because that way there's a better chance for patients to kind of adhere to their care plan, because their routine is not interrupted in a way that it will affect their outcomes.
So when we're talking about patient engagement, we're talking about partnership, and that means around people actually having a say around research decisions, versus with a participant, it's you're being actively involved in the research itself, but there is quite a difference between those two pieces.